Cardiovascular disease is the #1 killer in America. I'm Dr. Zachary Jepson, Medical Director of the Chest Pain Center at Salina Regional.
Dr. Jepson, thank you so much for being on the show. People don't really need to make the determination between indigestion and heart pain or chest pain. Why don't you talk about that?
Yeah, so I mean, if you're at home and you start having chest pain, and I mean, it's clearly something that's concerning you, we want you to call 911 because also, to be fair, people who have had heart attacks can suddenly, just die on the spot there. And so I don't want you behind, your vehicle and all of a sudden, like, you're driving and you have a heart attack and then you're also in a car accident. And so the other great thing is too, through this accreditation process, our EMS teams can do EKGs there in the ambulance and send them to us to review, and we can actually activate our cardiology team and cath lab that way before you even get to us.
Talk about the chest pain center as when somebody comes and presents to you in the emergency department with chest pains. Take it from there. Realistically,
chest pain is one of the biggest reasons for people coming into the emergency department, and clearly, you're worried about whether or not they're having a heart attack, and so of course that's what we're wanting to check too. And so when you get in there, there's going to be a lot of stuff happening really fast. We're going to try to get you back to a room as fast as we can and check an EKG to see if you're having a heart attack, and kind of based on that is where we kind of shoot off from what our decision-making pattern is, because certainly if it shows that you're having a heart attack, we're going to start this whole chain of events and getting our cardiologist involved and getting our cardiac catheterization team mobilized, just to make sure that we're really trying to get you the best, fastest care possible.
You kind of talked about the team there. The team becomes involved with the accreditation process. It's really more than a logo we can put on our website or talk about. Talk us about the accreditation process and to become an accredited chest pain center.
There's a lot of metrics, and I'm not going to get into those because it's just there's so many of them. And we've got a great team. I mean, Rochelle Giroux and Kristen Butler are really the ones who help kind of keep everything on track and get everything scored away on the back end. But it's just a lot of things through the American College of Cardiology, where they're showing us that these are the best practices that benefit, the most patients and how we can take care of them in the best way. And so now that we've become an accredited center, we've demonstrated to this governing body that we're doing, all the things that we should be doing and taking care of people the way we should be. And so I think the really, amazing thing is that, Salina Regional, through their administration leadership, they started with the trauma program, we did the stroke thing, and now we're doing, cardiac stuff as well. And I think it's really important that, that we're seen as obviously caring about the health of the region and the community. And the great thing is too, we've already had, a group of cardiologists in the region here, and I think the oldest cardiologist here is, or at least practicing, has been, here for 25 years. And so just getting everybody on the same team, and, we're all wanting the same thing and taking care of our patients in the best way. And I think we've achieved that.
For more information, please visit srhc.com, like us on Facebook, and follow us on Instagram and Twitter.